Hi, good morning. I'm going to be talking to you about epilepsy. It is an issue that I feel I know a thing or two about, as I was diagnosed with adult onset epilepsy at the age of 27. In no particular order, some things that we'll address today are things like the patient population that's affected, how epilepsy manifests itself, how the diagnosis is actually made, treatment options, and the way this disease impacts the patients who have it. So, what actually is epilepsy? Well, it is the fourth most common neurological disorder in the world. The things that are higher on the list, number one are headaches and migraines, two is stroke, three is dementia and Alzheimer's. Epilepsy is just another term for seizure disorder. And a diagnosis for epilepsy is made after a patient has two or more unprovoked seizures. Unprovoked seizures can occur from things like injuries that cause a traumatic brain injury or allergic reactions. So, some seizures also are caused by, like I said, injuries. You have febrile seizures in children, and even family genetics. Just some basic facts for you. 3.4 million people in the United States alone have epilepsy. 5 million people in the world are diagnosed with epilepsy every year. 1 in 10 people will have at least one seizure sometime in their lifetimes. And 1 in 3 people that do have epilepsy aren't controlled with medications. As mentioned in the previous slide, 1 in 100 people will have an unprovoked seizure sometime in their life. 1 in 26 people will be diagnosed with epilepsy in their lifetime. The most common populations that experience this are Hispanics, Asians, Caucasians, and African Americans. And it's slightly more prevalent in men than women due to issues with injuries that occur. And 1 in 3 people that have epilepsy also have a family member that have it. As mentioned before, in the gender prevalence, males do slightly beat the females for risk of being diagnosed with epilepsy. As you can see here, localization related is split right down the middle. On generalized, the females do take the lead, meaning that those seizures can affect the entire brain. Undetermined, the guys again take the lead, and in special syndromes, the males are way ahead due to things like sports injuries, traumatic brain injuries, those kind of things. So there are many different types of epilepsy. Don't confuse these with types of seizures. Generalized epilepsy is what you typically think of when you think of someone who has seizures. It's areas that affect the whole brain. That's the absent seizures, your tonic-clonic that you might know as grand mal. Focal seizures originate in one specific point in the brain. That's going to be something like your frontal or your temporal lobe. Then there's generalized and focal, whereas you can tell by the name, that's both kinds together. And then there's unknown onset. Nobody knows if they're generalized, focal, but somehow they just happen to the patient. The pathophysiology of every single type of seizure is different. However, in every seizure that occurs, they know that there is an imbalance between the excitatory and inhibitory forces. I explain this as kind of like children fighting to tell their mom one side of the story, and then all at once she gets mad and yells, "That's enough." And that's the point where the brain kind of loses it and has its seizure. There can be up to 4 phases of a seizure, and I say that because not everyone experiences the first 2 phases. The prodromal phase, only about 20% of patients have this, and it can occur days to hours before it actually happens. A lot of patients who experience this are empowered. They feel like they can make a plan when this occurs so that they're safe. The aura is also known as the early ictal phase. A little over half of the patients do have an aura. It can start a few seconds to an hour before the actual seizure. This also can include a focal aware seizure, and this is when you would want to start timing the entire duration of the seizure. Ictal is what you think of when you think of the patient lying on the floor. That is when you would end your timing as soon as that phase is over and they kind of come around. Postictal is the recovery phase. EEGs show that these can last anywhere from 7 seconds until days after the seizure is over. And of course, seizures manifest in lots of different ways. Focal seizures can manifest in a conscious way, which include things like altered emotions. The patient could be happy one minute and then sad or raging the next. Their senses change, like they'll feel tingling or something will smell or taste off. Sometimes they just have a sense of deja vu. You might look at them and notice their lip is twitching or they're doing something kind of off with their hand or one foot. Then there's unconscious or impaired awareness. This is where the person will not really respond to you if you offer some kind of stimulus. They look like they're staring out into space or having a daydream. A lot of these patients will smack their lips or tap their foot when they're having these kind of seizures. There's generalized seizures, which are kind of what we all think of when we find out someone does have them. There's atonic seizures, which are formerly known as drop seizures. This patient loses full control and just will unfortunately fall on the ground, a lot of times causing injury to themselves. Then there's tonic-clonic seizures, which were previously known as grand mal. These patients, like myself, will suddenly lose consciousness, their body will go stiff, they'll start shaking, and unfortunately, sometimes bodily function is lost. There are several tests that can be done to support the diagnosis of epilepsy. The most basic is just a neurological exam. That's going to look at things like your behavior and your affect, how you move. The doctor typically has a patient walk to and from the exam room door, stand on one foot to check for stability. And these kind of things help determine the kind of epilepsy the patient might have. Blood tests are used to check for infections like bacterial or viral meningitis, the Epstein-Barr virus, varicella zoster. Those things can cause seizures, and genetic conditions can actually pop up this way. And some of the genetic conditions are things like Angelman syndrome, Rett syndrome, tuberous sclerosis complex. EEGs are used to measure the pattern of your brain waves. Patients with epilepsy can have strange moments in their brain waves even when they're not having a seizure. CTs are used usually at the early onset, right after a seizure occurs in a new patient. That way they can see if there's a brain bleed or any tumors that might have caused it. An MRI does the same thing. It's a little more detailed than a CT scan and will allow the provider to see things like arteriovenous malformations that could have caused the seizure and a more detailed view of the areas that are injured in the brain. PET scans are also used. I've personally never had one, and my neurologist says it's very rare that they do order them, but they send up a radioactive material just like they do with a cancer patient, and it shows areas in the brain that are metabolizing that material, and areas that are more sluggish are typically where those seizures are originating from. One of the most common or the most common treatment modality is medication. Most patients only require one medication to keep their seizures under control, whereas others, like myself, require a mixture of multiple medications. It's a lot of trial and error and a very complex process to figure out which medications work to help control the patient. A lot of times, children outgrow their epilepsy and they stop taking medications fairly quickly after their last known seizure. They usually wait on adults to stop taking medications after 2 or more years being seizure free. Since these medications are designed to slow down our central nervous system, side effects are things like fatigue, dizziness, weight gain, memory issues. Some of the most common medications they use are Depakote. It's a very broad spectrum medication that covers all kinds of seizures. Lamictal is good for focal seizures. Keppra is broad spectrum, but most commonly used for tonic-clonic. Tegretol are used for partial seizures, and then there's Ativan, which is a rescue medication that we typically give via nasal spray for seizures that last longer than 5 minutes. Surgery is an option for patients when medication does fail. Surgeons only perform these surgeries if the location of the seizure occurrence can be pinpointed and if the area that spot is in, it's not going to mess with anything like their ability to speak, move, see, or hear things. One surgery that's often performed in children, I shouldn't say often, but that is performed mostly in children, is a hemispherectomy, which removes or disconnects the half of the brain where the seizure activities occur the most. Children are very resilient and are able to compensate fairly quickly. They use physical therapy and occupational therapy to help return to their baseline. Some patients will still need to take medication after their surgery, but most of the time they're able to take fewer medications than they were before or lessen the doses of the medications they were taking. Some of the newer treatment modalities are stimulation. Vagal nerve stimulators are placed in the chest, and there are wire connections made to the vagus nerve in the neck. The patient has a magnet that they use and they scan over that device in their chest. And at that point, it will send bursts of energy through that nerve, which in turn goes into the brain. These are usually known for reducing seizures by 20 or 30%, and that's because not all patients can feel those seizures coming on. Deep brain stimulation is where electrodes are actually placed in the brain, most typically in the thalamus, and there's also a device implanted in the chest. This device sends out timed impulses all the time, so the patient doesn't actually have to have a magnet or something of the sort to trigger the device to work. This is most used in patients whose seizures aren't well controlled with medication. And the newest one is responsive neurostimulation. And this device can actually perform sort of like a mini EEG, and it analyzes the brain activity and realizes when a seizure is starting. At that point, the device delivers that electrical stimulation to the brain to stop the seizure. And they found that this method has the least side effects and the best long-term relief for the patient. As far as the progression of an epileptic patient, some patients will experience an increase in the number and severity of seizures as they age, whereas other patients might have an occasional breakthrough seizure, but stay relatively well controlled. In general, though, the incidence of any type of seizure increases after the age of 65 for everyone related to strokes and dementia. Wrapping up, some of the impact on activities of daily living for patients with epilepsy. We have a 15 to 19% higher rate of drowning than everyone else. And this can impact something as simple as taking a bath without being supervised. My neurologist has me on an 8-hour work restriction, and as we know, most nurses work 12-hour shifts. In my state, we have to be 6 months seizure free before we can drive. So if someone has a seizure on month 5, day 29, that timer starts all over again. And if you're not able to drive, that can make it difficult to get to school. There's patients who are triggered by things like flashing lights, so going to a movie theater might be difficult, or going with their family to an amusement park and riding rides. A lot of medications can interact with our seizure medications, which can make treating things as simple as a sinus infection difficult. Contraceptive medications don't work as well on patients who are taking seizure medicines. And in the event that a patient does get pregnant, a lot of our medications can cross that placental barrier. And as a result of all these things and just losing a sense of independence, it affects a lot of epilepsy patients' just overall well being. But I've learned that it's what you make of it, and you take what you can day by day and try to see the positive in everything. I thank you all for your time and attention, and if you have any questions at all, please don't ever hesitate to give me a shout. Thanks so much.